Hey guys, this is Dr.Shivek. Welcome to my YouTube channel. So guys, this is the part 2 of my ARDS series, and in this video we are going to discuss about clinical features, diagnosis and the treatment of the ARDS. So guys, first of all, what are the different clinical features of the ARDS? First, dyspnea. Tubular breath sounds are heard in these type of patients. Tachypnea means increase of the respiratory rate. Tachycardia, increase of the heart rate. Increased secretions and the chest pain. So these are the different clinical features of the ARDS. So guys, as we know, in the ARDS there is a ratio of partial pressure of oxygen divided by fraction inspired of oxygen. So PaO2 is 60 divided by 0.2, which is FiO2. The ratio will be 300 mm of Hg. So as we know, in the ARDS, the patient will be presented with less than or equal to 300 mm of Hg. So depending on this ratio, we are gonna classify the ARDS in the mild, moderate and the severe. So in the mild ARDS, the ratio will be 200 to 300. For moderate type of ARDS, ratio will be 100 to 200. And the severe form of the ARDS, this ratio of partial pressure of oxygen and the fraction of the inspired oxygen will be less than 100. So guys, this classification is very important for you in clinical situation like type questions. So now, what are the different methods how we diagnose this ARDS? First of all, there will be shortness of breath within the first week within the first week. Okay, the patient will be presenting with the shortness of breath. Firstly, we can go for chest X-ray, and there will be bilateral pulmonary infiltrates. As you can see here, this is a chest X-ray, and these are the bilateral pulmonary infiltrates. So this is very important diagram of ARDS. Guys, this is very important. Now, third option is PCWP, means pulmonary capillary wedge pressure. As we know, in this acute respiratory distress syndrome, pulmonary capillary wedge pressure is less than 18 mm of Hg. As we know, this is less than 18. To measure this pulmonary capillary wedge pressure, how we can measure this? You can see here that catheter is going from the right atrium, then right ventricle, and from right ventricle to this pulmonary artery. Okay, and the balloon is inflated here. So from this we can measure the pulmonary artery pressure. This will be the pulmonary capillary wedge pressure. Now, the fourth option is a CT scan. Here in the CT scan, we can see consolidation and the ground glass opacifications. So this is the ground glass opacification and consolidations. You can see here, guys. Now, what are the different treatment options for the acute respiratory distress syndrome? First of all, we can go for the prone ventilations. By proning the patient, there will be diaphragmatic compression is relieved and the gaseous exchange will be increased. So more of oxygen is going. By this technique, we improve the ventilation and perfusion ratio. This ratio will increase. Okay, and this have to be done every 12 to 16 hours. But this is contraindicated when there is a chest wall abnormality. The patient having chest wall abnormality, we can't do this prone ventilation. Second option we have invasive ventilation, means we intubate the patient and take it on the mechanical ventilator. So what are the different settings we have to do in the mechanical ventilator for this patient? Tidal volume should be low. This TV is the tidal volume, and we will keep 4 to 6 ml per kg of the tidal volume, means if the patient is 50 kg, if the weight of the patient is 50 kg, then we will keep the tidal volume of 200 to 300 ml tidal volume, and there will be high PEEP. PEEP is the positive and expiratory pressure. So what is this positive? What is PEEP? This is the pressure in the alveoli which prevents the collapse of this alveoli. So it is present in the alveoli. We have to keep it 12 to 15 mm of Hg. So guys, this is very important. You have to learn these values. Now another setting is the FiO2. We have to keep FiO2 less than 60%, and inspiratory to the expiration. This is the inspiration to expiration time should be more than 1, means the time taken by the inspiration should be more and expiration time should be less. So these are the different settings in the ventilator we have to done for this patient. Now another, we can give also steroids to this patient, and we have to maintain the adequate fluid in the electrolytes. Now coming to the severe ARDS treatment. For the severe type of ARDS in which the partial pressure of oxygen ratio FiO2 is less than 100, we can go for ECMO. So guys, ECMO is also a very important question. ECMO full form is the extracorporeal membrane oxygenation. In this technique, guys, you can see it here in the image. This is ECMO machine. Here we get the blood, deoxygenated blood from the patient, and oxygenate in this chamber and push the oxygenated blood to the patient. So oxygenated blood is pushed into the patient, so it will improve the ARDS. So this is the ECMO machine, guys. So thank you guys. This was the very important topic, ARDS, and I hope you like it. This is Dr. Shivek signing off. Bye bye.